Why are you interested in being on the Central District Health Board?
Well, I've been a member of our community for 18 years with my family and had the privilege to raise 6 daughters here. I love Idaho, love our community, and what I do on a daily basis is day in and day out seeing the patterns of health, wellness, illness in the community, through my day job in the laboratory setting. So I see the broad patterns on a daily basis, and I see where we're doing well, and I see where we can make an improvement. And I understand very much where we, as a community, need to guide and direct some of our public health decision-making in terms of the stated goals of the district, Central District Health Board, and that's providing for the long-term wellness of the community and improving the health of all of our citizens.
Okay, Commissioner Davidson.
Thank you.
No,
First of all, thank
Commissioner
you.
Kane.
Thank you.
Yeah, for throwing your hat in the ring. You know,
Thank
this
you.
is a big deal, right? And it's
It is.
it's for 5 years, and there's a lot that CDH actually tackles beyond COVID. So
Indeed, and that's important.
It is important, yeah.
Absolutely important, because COVID will come and COVID will go. But
Exactly.
it's far more important of the big picture community health. I'm sorry.
So
go
to
ahead.
that end, why don't you tell us how your experience, your education, your expertise really lends itself well to CDH's mission?
Okie dokie. So I'm an anatomic clinical pathologist, Mayo Clinic trained, surgical pathologist as well, way too many years of school. As well, my subspecialty is dermatopathology, skin pathology. I did a year of immunology research, PhD research, as an MD PhD candidate as well. In addition to that, I worked emergency rooms for 4 years, family medicine for 3 years, and dermatology clinics for 3 years. So I'm a broadly trained clinician. And I've been the state and the regional inspector for Idaho and Montana for the College of American Pathologists. I've done inspections in Washington, California. I actually had to shut down a hospital in California a couple of years ago as the chief inspector on that. So I broadly understand how community health systems, hospital systems, et cetera, work. In terms of my background and training, I would posit that there's probably not a whole lot of doctors in the state that have seen more patients in their career than I have. I've seen about 350,000 patients through my responsibilities, my career. So I broadly understand human health. I understand deeply the mechanisms of action of health and wellness. Critically important to me in terms of the things we do as a community. Again, far beyond COVID. This, COVID is the moment, but beyond that, I have daughters who are in fields that relate to health and wellness, nutrition, et cetera. We as a family have worked very closely with the food bank over the years, et cetera. There's a lot of things we've done investing in our community to make sure in the long term, we as a community can be a shining example for other states and other communities, especially our district for one. And there are patterns we see that unfortunately things we can prevent, in terms of long-term health and wellness. So for me, it's far beyond just the heat of the moment that we're experiencing, but health and wellness, I'm kind of the tip of the spear in what I do on a daily basis in terms of seeing, I'll personally see about 30,000 patients this year through diagnostics, but through the laboratory setting on a daily basis, I consult with hundreds of doctors around the state. They'll call me, what do I need to know about this disease? So I love to educate. I'm actually licensed in 12 states, and I do work for doctors and patients all around the country as a consultant. And as this year's hit, I've become kind of a go-to expert in terms of understanding disease patterns, epidemiologic patterns, et cetera. Literally doctors coast to coast call me on a daily basis as well as patients. So broadly trained, deeply, broadly experienced, and just would love the opportunity to continue to apply that to help people.
Thank you.
Commissioner Davidson.
So, in your practice, are you seeing any trends, anything that maybe Central District Health is behind on that you could bring to the forefront?
In terms of like the viral trends at the moment?
No,
or,
any health trends in general.
we do have some metabolic issues within our community, and I know, as Central District works with, the WIC programs and some of the family access programs and some of the smoking cessation programs, things of that sort. Yeah, some of the trends are we are metabolically unwell to a high degree within our community. And that's on, long-term hemoglobin A1Cs, diabetic patterns, et cetera, cholesterol patterns, screening patterns. So as I see some of those messages are important. Another one that I know some of you have seen some of my talks. Fall and winter, we are a very vitamin D deficient community, and you can look at the 191,000 patient Quest look back at COVID and vitamin D levels, and directly correlated. And that, that's just a message, it's not the be all end all, but it's one of the messages that could help going into the fall and winter, not just for COVID, but any flu and cold seasons. So I see those patterns are deficiencies, nutritional deficiencies, vitamin deficiencies, markers of chronic illness.
Are you
Yes.
saying a lot of the things you're seeing are possibly related to diet?
Oh, yes. Oh, yes, yeah. As Hippocrates said 3,000 years ago, let thy food be thy medicine, let thy medicine be thy food. Every physician's job should be to put him or herself out of a job by creating wellness for their patient cohort. So that should be the real goal of medicine as a physician. Put yourself out of a job because your patients are well.
Thank you.
Okay. The question I have for you now is, being on the board of Central District Health, you're primarily in charge with strategic planning, making sure they stay within their budget, actually developing a budget. So my question is really twofold. Are you familiar with the Central District Health budget?
I haven't seen that budget in particular, in terms of reviewing it and planning that budget. That's not in my wheelhouse in terms of having done that.
Sure.
For that. Having budgeted, yes, I have 80 employees. And
How many employees you have?
80.
80, okay.
So I've run a fairly large business, and it's grown over the years. So I have a very tight ship that we have to run budgetarily to be responsible for that many
And so
individuals.
that's what you do, one of the things you do. Do you work and set the budgets, or is that, do you have a group that does it?
We have a
or-
group. I have my business operations manager, my better two-thirds. My wife is much better with numbers than I, but we all sit down together and do our annual departmental budgets. Absolutely. But at the end of the day, the decision comes to me.
Well, sure. All right. Well, we'll see that's one of the issues I think that we need to really focus on is primarily because the state legislature passing House Bill 316 puts most of the budgeting to Ada County. And some of it with the surrounding counties, but most of it, 92% of the budget will be from Ada County taxpayers.
Gotcha.
And the state will not be contributing much, and so that's really important to us, is the budgeting aspect of it. And frankly, that's one of the biggest things that the board does, is budget and
Well,
make
as a
sure-
taxpayer, I care where those dollars go as well, and we want to get the most bang for our buck out of those. We want, if you're going to spend a health dollar or a wellness dollar or an education dollar, it needs to be impactful, not just in the moment, but in the long term.
So I just want to make sure I have this correct. So your Cold Diagnostics, because
Yes.
that's your company, that you have 80 employees in your Cold Diagnostic,
Correct.
and so you do all the HR stuff and all that. And
Yeah, well, I
with
have
80 employees. Well, you have
A
people,
great team
you have
that
people
helps
that-
me,
you have
but
people
yeah,
that
at
do
the
it,
end of
yeah.
the day, I'm the decision
Yeah,
maker.
you have people that do it, but you're in charge of that. Okay.
Yes.
All right. Commissioner Dave, Commissioner Kenyon. I've done
twice
that a couple
today.
of times. I know. No,
Maybe
Commissioner
we'll
Kenyon.
switch chairs.
Yep.
So I really like what you were talking about, where you were going with that our community has metabolic challenges and identifying some of those, whether it's diabetes, like obesity, et cetera. And yeah, vitamin D isn't the end all be all.
No, it's not.
But, having mentioned that, I think we're not focused on solutions when it comes to this pandemic. We've been focused on a lot of different tactics and politics and whatnot. But if you look at the root cause and you look at root causes and then what can we do backing up to underlying help people fight this pandemic, and it's probably not mass, it's probably immunity systems. It's getting
100%.
healthy. And so how can you help not only push that message, but actually teach people what we need to do differently? I see how we eat up here in this office, and I'm just like, oh my God, we're eating donuts and we're pouring crap in our coffee, and we're just constantly putting poison in our bodies.
Right.
And you can't expect them to fight off, right, the pandemic, whether it's the virus, the COVID-19 virus, or
Right.
obesity or whatever. So I'm really interested in that conversation. I'm really interested in where we go from here in helping our community become like one of the blue zone communities.
Absolutely,
Right?
yes.
What steps can we take? Because we've talked about it for a long time.
Mm-hmm.
And I look around and we have one of the most obese, unhealthy communities I've ever seen.
Mm-hmm.
And frankly, I think, we're going to suffer from that, and we're going to suffer from diseases and cost
Correct.
until we address that issue.
I couldn't agree more. My daughter's actually writing a chapter with Dan Buettner. She's been working with his Blue Zones work. Yeah, for me, I mean, that's the key. I mean, in retrospect, we want a pandemic proof for the future. It is about immune health, and we've left that message. And I think this is part of where we engender the public's confidence and trust is by emphasizing the things that can be done, the things that are long-term useful, and a public health trust and belief in what you're teaching, and being very data-driven. I mean, it's one thing to give an emotional argument, but it's a second thing to say, here are the data. And if we as a community are immune compromised, if we're obese, et cetera, we need to be truthful with the community and say, here's what we're here. I mean, doctor means teacher in Latin. I love to teach. And part of what we teach is wellness. And yes, it's not just vitamin D. It is at the tip of a fork. And yes, it is in our sleep patterns. And yes, it is in community gathering and mental wellness for immune health. There are so many factors that play into that. And I think that's a prime opportunity for a central district health board, is to teach and educate, again, not just for the moment, for into the future. To your point, the number one risk factor, CDC did a 554,000 patient look back. Number one risk factor was obesity for poor outcomes in COVID. But the second one, surprisingly, was fear and anxiety disorders. And number three was diabetes. So if we look at those things and we focus on community physical wellness, obviously, but psychological wellness and mental wellness, absolutely. I mean, preach, that's exactly.
Well, and I look at COVID as perhaps being the greatest opportunity that we
Yes.
have as a community. And instead of dividing us, it can actually be something that brings us together.
Health and wellness is not
Because nobody's going to
political.
fight over
No.
whether you should eat carrots or not.
No,
They'll
health
fight
and
over a
wellness,
mask, but let's
right.
give them something, the community is something we
Yeah.
can all get behind.
Yeah, when you mix medicine and politics, you get politics, but health and wellness, the virus doesn't care what party you're from. The virus cares, and any virus, any influenza, it cares about what's your immune status going into an illness season. And I think that's a prime opportunity to reemphasize and put public health at the forefront and say, hey, we're here to teach and guide and improve the health of the community, as it says in the statement, for the long term, into older age and wellness. I think we all want to live old young. And we can't do that if we're not doing the proper things. And I'm not here to judge anyone. I lost 46 pounds 8 years ago, and changed my lifestyle. After a pound or two of weight every year of marriage, it's like, I need to do something different.
Well, we all have the COVID-19, I think, and we need help.
I lost the COVID-17. It was such a stressful year on my side. I pretty much worked 100 hours a week this last year, so it's finally slowing down enough that I think I know who my family and dogs and farm animals are again. I don't know.
Commissioner Davis.
Well, I want to ask you about your views on individual rights. So, obviously, governing is an art, not a science. Medicine is the science. You're going to have, we have one side of it, which is just the pure science of the disease. But you're going to be on a board, potentially, where you have some political power to determine what policies should be implemented to combat the disease. The previous board, instituted things like shutdowns and mandates and things like that, things that people thought were too much of an infringement on individual rights based on the severity of the disease. So how do you balance individual rights with trying to treat the public as a whole?
Mm-hmm. So to that point, I think health freedom is critically important. And if we teach people correct principles, then we don't end up with as much of a health issue. In retrospect, yes, the virus at first, we used the precautionary principle and 15 days to crush the curve, et cetera. In retrospect, when we were able to start to see the patterns within world patterns, I think we had the opportunity and perhaps missed the opportunity to say, okay, we see who's being affected the most. Let's protect those. We literally went against the WHO's pandemic guidelines based on severity of the numbers. Health freedom is critical. Literally, physical integrity, it is your body, it is your choice. You should be able to be a responsible citizen, but a free citizen to make the health decisions that are best for you. We as a community should help people make those, but I think forcing things engenders distrust. I think guiding with proper principles based on solid, strong data is critical, but standing for the freedom of the individual. Health can be used in a very tyrannical form we've seen through history. And I think we don't want to replicate those patterns because, again, the more forceful you are without evidence, the less trust over time you will have from the community back in your direction. So I think it's very important to find that balance of education, proper responsibility, both fiscally, proper responsibility with real data, and keeping the politics out of it and the health and the wellness. But I mean, if something is supposed to be super bad and it ends up not being it, then we have to be honest and say so. So it's looking at the big picture. Yes, it involves consensus, but it also involves being constitutional. I mean, we are a nation of laws, and we should follow the rule of law. And I think it's critical that if we are to remain a nation and a free people, the law is present for a reason.
Thank you.
If you were to be appointed to the Central District Health, what would be your top 3 priorities as a board member?
Well, to Commissioner Kenyon's point, I think metabolic wellness of the community and education. So number 1 would be education, and focusing on the programs that we will obviously need to do to pandemic-proof ourselves for the future. Number 2, I think it's critically important. I mean, any community, the way you determine how decent and how well a community is, how well you treat the least of these. The poor, the indigent, those who don't have access. So number 2 is making sure there is good access to good guidance, good education, good health care for those who are the least among us. So that would be number 2. And number 3 would be to bring calm and common sense back as a team to work together. I don't care if you're blue, red, purple. What matters is working together for the health and wellness. So bringing decency through data. I'm very data driven, I must admit, but bringing decency and collaboration into the wellness, because again, health and wellness isn't political, and it shouldn't be. It should be a team effort for us to make, Commissioner Kenyon's point, I can't agree more, to make us as Boise, Idaho, a blue zone, one of the healthiest regions in the world. And through those messaging programs, through the educational programs, through implementing what the mandate of the board actually is, that should be the goal. And I would emphasize those 3.
Well, I appreciate that. In fact, one of my actually surprises of this whole thing is those that are decrying politicization are the very ones that are bringing politicization to the issue. And I'm going, it's not us, it's you. I agree with your position there. We should be calm. We should just do the best for our community, and the virus or any other, and they don't care about your politics.
I think everyone needs to be heard, and I think that's the important message lost in this year. Having been in the thick of it myself a time or two, when you get caught in sound bites, you get misinterpreted. There's so much nuance in life that gets missed when we don't communicate. And I think being able to be heard and allowing others to be heard, the answer almost always falls somewhere in the middle. It tends not to be in an extreme. And for public health, again, non-politicizing it, it's listening to each other. No idea is a bad idea when you're trying to do something good for a community. So you put all of the ideas on the table until you distill it into the best plan.
Thank you. Commissioner Kenyon.
Oh, thank you. It's been calling me Commissioner Davidson all day.
Twice.
So to your point about politicizing, you've been sort of painted into
Yes,
the,
I have.
the red Republican corner, as Dr. Blue has been painted into the blue, Democrat corner. And so I don't think either one of you really got into this because of politics. And you've been criticized openly by some folks in the medical profession, by some of your practices or some of the things that you've said, and it may be sound bites or whatnot. You want to just address that a little bit more, because we, I think, as a board, are entrusted with a higher mission, and it's not choosing sides. We represent everyone in the community. We ran on a party ticket, but we got elected, and once you're elected, you're here to represent the entire community.
Absolutely.
Not just the Republicans or the
Absolutely.
Democrats. And to think that all people just get put into two buckets is a little simplistic to me.
Way too simplistic.
It is way too simplistic. And so I think our higher calling and what we try to do, and we've tried to do this since day one, is to try to take the politics out of things as much as possible and not listen to one or two or three or four people, or for people that are just sending out massive email groups. We've got to collectively as a board look at intelligent information, empirical data,
Absolutely.
things that have been collected by numerous resources and then evaluated and analyzed by a larger group of people, not just a guru like Dr. Cole, right? And so, I think any person that comes on this board, I really want them to understand that I think that's where we're coming from. And we're not going to be making a political decision here today. I think the media would like us to,
Oh, sure.
but I don't think that we've proven in the past that we do that. We've tried to be logical and analytical and listen to everybody. And so
Certainly.
if you have any comments on that, that was more
Thank
just
you.
a statement.
Yeah, thanks for that opportunity. And here's the challenge. There is, having studied thousands upon thousands of articles and thousands of hours of studying, when you get caught in a soundbite, there is so much data and so much nuance. And nothing I have said, because one color has glommed onto a few things I've said, what I've said has been based on scientific data. Now, people have painted me into a corner. You'll find that I'm probably more alt-middle in life than most people would imagine. I'm very much an independent thinker. Now, here's the frustration. You get interviewed and then you get quoted in the media, but they say nothing that you said. And distilling thousands of hours into a few minutes soundbite or a 5-paragraph soundbite is not generally fair to the individual. Because you'll find that I'm pretty apolitical, to be quite honest. I care about health and wellness, medicine. My life is the patient always comes first, the patient always comes first, the patient always comes first. And that's how I've lived my life for the last almost 30 years as a physician. Patient always comes first. Now, when it comes to taking somebody out of context, I have opened the invitation to any and all of my colleagues. I have said, let's sit down for coffee, let's sit down for lunch. I've talked to some of the media sources, said the same thing, and they say, crickets. I'm here to have that honest, let's hear both sides, let's see your data, why have you come to your conclusions, why have I maybe come to a different conclusion? But the most honest answer in life, especially as a physician, is I don't know, or I could be wrong, and teach me. And I think that's the opportunity we keep missing by either speaking over each other and or not listening to each other is show me where I'm wrong, show me where I'm right, but teach me so that it's not about me or my ego. It shouldn't be about anybody else's ego. It should be about what's the best thing for the patient and or what's the best thing for the community. So it falls far beyond those sound bites and being taken out of context or saying, well, people on this side like you. I'm like, I'm sharing data. If you like it, great. If you don't, great. I'll share the same data wherever.
Follow up just really quick.
Yeah.
So, Dr. Cole, why do you think like the medical society, I think it's the Idaho Medical Society, put their endorsement behind Dr. Blue instead of you. And they're not a political group. That's a group of doctors here in Idaho.
I think there are systems interests, to be quite honest, and there are financial interests. I have no commitments to large systems making decisions. I'm an independent physician. And as an independent, because of some of the things I've said, yes, I've spoken out for early treatment. Yes, there's a ton of data supporting it. I've spoken out against treatments that are being used that have been recommended against in big systems. I think there's backings of big systems and big money, and I always say follow the money. My life philosophy has always been do the right thing, the right way, for the right reason, and you don't have to think about money. And unfortunately, because medicine has become so corporatized and we've run into the corporate practice of medicine, it's been to the detriment of the community and the patient over time. So I can't put any thoughts in anyone else's head, but that would be my supposition.
Commissioner Davidson.
When this
Short
pandemic,
question, short answer.
Sure. when this pandemic started, the government didn't have all the answers for COVID-19, and as it has evolved, the CDC has had to go back on certain things they've said. Just even the basics of where did this come from, and for a while the media was telling us it was a debunked conspiracy theory that it came from the Wuhan lab. Now that's back on the table. Even Dr. Fauci says that. So as this, as the data has come in over the last couple of years, have you made any theories based on the data that you have changed as more data has come in?
In terms of like where the virus came from or what we're
Just
up
in
against?
general.
Oh, I mean, it's a real virus and it's a deadly virus, and we know the risk cohorts it affects. It's mutating. This is a critical public health message right now. Delta has escaped what we're doing. We need to societally pivot right now. Delta, if we look at the data from around the world, look at Israel, 80 to 90% of people in the ICUs are double vaccinated. So we're giving a vaccine right now for something that was 4 variants ago. It's like saying to your hospital employees, all right, flu season's coming. Let's give you the flu shot. Oh, by the way, we have some leftover vials from 4 years ago in the freezer. You wouldn't do that. That's about the same efficacy we're seeing giving a Wuhan vaccine against a Delta variant. And even though just a week ago officials were saying, oh, this is a pandemic of the unvaccinated, now that we have the world data tends to be much more up to date and prescient than what we have here. We have kind of a retrospective reporting system and not a prospective one. So we really, as a society with the virus right now, we are not going to see as big of a bump. We're going to see the same patterns in Europe. Delta is about 10% of what we had back in the fall. Yes, the virus is evolving and changing. We need to pivot. Even Fauci on the 3rd or the 4th of this week said, look, we need a treatment that we can start early, finally talking about early treatment, a pill that we can give 7 to 10 days that's safe, that's effective, and I kind of think, we kind of have some of those already, and a lot of us around the world have been using them and saving countless lives doing it. The virus is real. I think we're moving quickly towards herd immunity. The good news is if you look at India, they now have 70% seroprevalence, meaning 70% of people with their Delta surge they went through with a much lower death rate than the rest of the Western world experience. I think there's room for optimism, but at the same time, we need to focus on those who are still at risk.
Thank you, Dr. Cole. Did you have any questions for us or a closing statement if you'd like?
No, I'm just very grateful for the opportunity to meet. I would be honored if I get the opportunity to serve, and if I don't, I'm still going to be part of the community and here for the health and wellness of everyone.